University of Maryland, Life University, and received his doctorate from Logan College of Chiropractic. As I mentioned, he is the founder of Upper Cervical Chiropractic of Monmouth. It's located in Marlboro, and in just under 5 years has overseen more than 40,000 patient visits. You tired yet? Not at all, right?
Still going, just getting going.
He has become well respected within the profession, and most specifically the upper cervical specialty. He's currently helping to design a postgraduate doctorate program to educate future doctors on upper cervical chiropractic care. Dr. Arbeitman has been asked to speak all over the country to colleagues, students, and the general public. Tonight, it's our pleasure for him to tell us about his book, The Gift of Hope, Path Through Healing Through Upper Cervical Chiropractic. Without further ado, Dr. Larry Arbeitman. Wow, I better not disappoint now with that kind of intro. No pressure. Well, first of all, I want to thank everybody for digging out of the snow. It only took you all a week to get here. How many people in here have a cell phone? How many people in here have a birthday? If it's not your birthday, shut your cell phone off. If it's your birthday and your cell phone rings, we're all going to sing happy birthday to that person. Deal? Okay. How's my mic? Good? Cool. Saying happy birthday. It's not my birthday. Okay, well, first of all, I want to congratulate all of you for being here. First of all, to the practice members, I truly appreciate each and every one of you for selflessly bringing people into our space to learn more about what we do. For those of you who are guests, I feel that I've met most of you, and if I haven't, I look forward to meeting each and every one of you. We're going to have fun tonight. Now, I'm going to ask questions, and I'm going to expect that you guys will participate and answer them. You're in trouble because you're right in the front. First question. How many people in here want to be healthy and happy? Let me see your hands. We all have something in common now. Terrific. We've been doing this event over the years, and this is probably close to the 10th time we've done it. And typically we'll do it upstairs in a much larger venue, 100, 120 people. And more recently we've decided to come down here and make it more intimate. I really do believe that by the time I get done talking in the next 25 minutes, that you're going to have an opportunity to not only impact your own life, but those around you for the better. Now, a few years ago, when we did this presentation upstairs, it really stands out in my mind because typically we'll have a member of the practice share their experience under upper cervical care, and we actually have two members here that are gracious enough to share their experience under upper cervical care. They're going to come up shortly. But what happened a few years ago was special. Picture this, 100 to 120 people upstairs and not a dry eye in the room. Everybody's crying. As Pat, the mother of Stephanie, is telling the story of Stephanie's recovery. Now I know everybody in here has a story, but Stephanie's story is remarkable. And for those of you who were at the last time I did the dinner, I have to share the story again because for me as a practitioner it was completely life-altering. Stephanie was a 16-year-old gymnast when she first came to our office. She was a grade A student at Freehold Township High School, volunteered, extracurricular activities. She was out to the movies one day with her girlfriends and went paralyzed from the neck down, sitting there watching the movie. They rushed her up to Robert Wood Johnson. They ran the battery of tests, the blood work, the imaging. They came back to Mom with a diagnosis of Guillain-Barré syndrome. And for those of you who do not know, Guillain-Barré syndrome is a progressive neurological disease that can result in respiratory failure and death. The diagnosis was wrong, as many times it is, and Stephanie began to regain movement of her body. But she was left with such bad chronic muscle pain and fatigue that she could no longer go back to school. She was out of gymnastics and had no social life. Over the next year, Pat and Stephanie went to the biggest and best doctors on Park Avenue. They went down to Children's Hospital in Philadelphia. They went to the infectious disease doctor, the pediatric neurologist, the orthopedic surgeon, and they got a lot of this. Now, she was on all kinds of pills and narcotics and antibiotics and antiviral drugs. Finally, they said, we think it's in her head. You should take her to a psychiatrist. So their intentions for Stephanie were good. They were doing the best they could with what they had. So finally, Pat decided to go outside the box. And through word of mouth, she contacted our office. I'm very happy to share with you that right now Stephanie is on scholarship at Seton Hall University. She has completely recovered her health. And she still pops in when she's home for breaks, Thanksgiving, Christmas, spring break, for her alignment and her adjustment. And I'm going to share with you over the next 15, 20 minutes how Stephanie actually healed and recovered. What actually went on from where she was to where she is now as we come for full circle. I also do believe that tonight you'll have an opportunity. You'll have an opportunity to make a great healthcare decision for yourselves. But if we're going to talk about health, and we all want to be healthy and happy, I think it's really important to define the word health. Well, let's start here. How many people in the room, by a show of hands, want to be sick? Well, here's the fact. If you live in this country, 1/3 of Americans are chronically ill by the age of 65. So do me a favor. Look to the left. Okay, look to the left. Look to the right. If they look pretty good, it's you. In all seriousness, the quality of your life depends on the quality of the decisions that you make. How many people in the room are healthier today than they were 5 years ago? Raise your hand. Terrific. How many people believe that it's possible? There's a possibility that 5 years down the road in 2015, you could be healthier than you are today. That's a very important belief system to have. When I do programs like this, and I ask the public, well, what's your definition of health? I typically hear the answer, if I feel good, I'm healthy. Would you guys agree? No, good. You've been to my program before. Of course not. Now, don't get me wrong. We would all prefer to feel good, and I would prefer for you to feel good. But it has very little to do with our health. Cancer, heart disease, stroke, diabetes, hypertension, AIDS, osteoporosis. These are some of the worst conditions that we have in our culture. And these people feel good. They're asymptomatic until they go for some sort of screening and they get a diagnosis. And on the flip side, we've all gotten up to go to the bathroom in the middle of the night, caught our toe on the corner of the bed. It's the worst pain in the world. Yet it has no bearing on whether or not we're healthy. So just looking at your body's symptoms to determine your health status isn't always the best strategy. Feeling, I'm not sick. Well, when I'm not sick, I'm good. I'm healthy. Well, let me ask you a question. Would you rather be rich or just not poor? Smart or just not dumb? Would you rather be pretty or just not ugly? Would you rather be healthy or just not sick? See, not sick is so mediocre. And this is how it works in my mind. Here's illness all the way down here. Here's wellness all the way down here. Not sick is right in the middle. And so many, I call this false wellness, where we think we're doing okay and we're kind of coasting. And so many people live like this. Symptom, get it ameliorated, not sick. Symptom, not sick. How's my dancing? If you're alive, you're on the continuum, whether you like it or not. The thing that's not as obvious, if you're alive, each and every day, we're either moving towards illness or towards wellness. Nothing living stays still. So each and every day, we're making good quality decisions about the way that we live, that when we look down the road 5 years from now, we're in a much better place.